Hello and welcome to Workshop 3. Today we will talk about common complications that may appear as Alzheimer's disease progresses and practical strategies caregivers can use to respond to each one. Funder acknowledgement. Here's a little bit about CASL. And these are some of the services offered at CASL based on our 4 different departments. Okay, before we get into today's content, let's do a quick review of what we covered in Workshop 2. In Workshop 2, we learned that Alzheimer's disease progresses through 3 stages: early, middle, and late, and that each person's experience is unique. We also covered a few important points. Common changes include gradual memory loss, trouble communicating, and changes in physical abilities. If a person depends on prompts and reminders to get through their day, they are likely in the middle stage. Sudden changes in thinking or physical function are not the result of Alzheimer's. If you see a sudden change, contact a doctor right away to find the cause. In the early stages, people may begin having trouble with thinking, memory, and problem solving. Caregivers can help by setting up daily routines, breaking tasks into smaller steps, and using tools like pictures, timers, or simple to-do lists. Today, we built on that. Now that we understand how the disease progresses, let's look at some common complications that may arise and what you can do about them. Not everyone with Alzheimer's will experience all of these changes, but learning about them can help you feel more prepared and know when to seek help. Even as abilities change, a person with Alzheimer's can still live with dignity and remain as independent as possible. The common complications we'll cover in this workshop are eating and swallowing, incontinence, seizures, and changes in walking and balance. As Alzheimer's disease progresses, some people may have trouble eating or swallowing safely. This can happen for several reasons. They may forget what they had already eaten or forgot how to chew and swallow food. They may not notice that they're hungry or thirsty, making it harder to eat or drink enough. Also, the muscles used for swallowing can become weaker, and the body may not protect the airway as well when food and drinks go down. These changes can lead to weight loss, poor nutrition, and an increased risk of choking or aspiration, which is when food or liquid enters the lungs and causes infection. Here are some helpful strategies. Allow extra time for meals. Don't rush. Offer finger foods that are easy to pick up or cut food into smaller bites. Serve smaller meals more often throughout the day instead of one large meal. Watch for signs of difficulty such as coughing or gagging during meals. If you have concerns about swallowing, talk with a healthcare provider. They may recommend a swallowing evaluation by a speech therapist who can suggest safer food textures or feeding approaches. Incontinence or bathroom changes. As brain function changes, loss of bladder or bowel control can become more common. Memory problems can make it harder for a person to notice the need to use the bathroom, find the bathroom, ask for help, or remember the steps involved in toileting. Some common strategies include: give verbal reminders to use the bathroom and place a sign or familiar picture on the bathroom door to help them find it. Create a toileting routine. Encourage bathroom use at every 2 to 3 hours while awake, and about 30 to 40 minutes after meals. You can also limit drinks before bedtime to reduce nighttime accidents. Seizures. What to look for. People with Alzheimer's disease and Down syndrome have a higher risk of experiencing seizures. As a caregiver, it is important to know the signs to watch out for. Sudden changes in alertness or consciousness, repeated jerking movements of the arms or legs, long staring spells, sudden stiff or startled movements, or even loss of consciousness. It's important to note that a first seizure may not always be witnessed. If you find the person you support on the floor for an unknown reason or notice repeated unexplained falls, this could be a sign that a seizure has occurred. Okay, when to seek help. If you see new seizure activity, contact a healthcare provider right away for further evaluation or guidance. Try to describe what you observed as clearly as possible, including when it happened, how long it lasted, and what it looked like. While seizures cannot always be prevented, early detection, proper treatment, and medication management can help reduce how often they occur. Walking and balance. As Alzheimer's affects memory and physical abilities, changes in walking and balance may occur. Memory problems can make it harder to recognize surroundings or safely do tasks like climbing stairs or stepping off a curb. These challenges can be compounded by other factors, such as poor vision or hearing, weaker muscles, joint pain from arthritis, or side effects from medications that cause dizziness. All of these factors together can increase the risk of falls, which can be very serious if they cause injuries. Preventing falls. To help prevent falls, caregivers can offer help when the person is in an unfamiliar place or walking on uneven surfaces, stairs, curbs, or door thresholds. Make sure the home is well lit and keep walkways clear of clutter and tripping hazards like loose rugs, clutter, and even pets. Encourage the use of sturdy, well-fitting shoes and clothing that fits properly. You can even use a gait belt if needed when assisting with walking. Staying physically healthy. As dementia progresses, people can be more affected by physical setbacks, even from small illnesses like a cold or mild infection. This is why it is so important to support overall health. Simple steps can help prevent more serious problems. We can help prevent illness by practicing good hand washing and avoiding close contact with people who are sick. Make sure to keep up with regular medical checkups and recommended vaccines. Make sure the person you care for eats well and drinks enough fluids to prevent dehydration or constipation. We can also support good oral care, healthy skin, and proper foot care. And we should always check skin regularly for redness, irritation, or breaks, especially in skin folds and the groin area. Additional resources on how to stay physically healthy are included in the asynchronous materials. I just want to reiterate again that sudden changes are not attributed to dementia. Sudden causes may be a sign of delirium, a rapid onset of confusion that can be caused by infections, dehydration, pain, or medication side effects. Many of these causes are things caregivers can help prevent. People with Alzheimer's are more likely to develop delirium, but it can also often be reversed if the cause is found and treated quickly. Never assume sudden changes are just part of dementia. Getting medical help right away is very important. Now let's put what we learned into practice with 3 short scenarios. For each one, think about the stage of Alzheimer's and how you could help. Scenario 1. Peter is becoming frustrated easily, repeating the same questions repeatedly, and sometimes refusing to bathe. Which stage of Alzheimer's is Peter in? Take a few moments to review the stages of Alzheimer's handout to determine what stage. Okay, Peter is in the middle stage of Alzheimer's. Resisting the bathing is common at this stage. Here are some helpful approaches. Use calm, gentle language. Instead of "let's take a bath," try "let's freshen you up so you can feel more comfortable." Respect timing. Let Peter bathe when he feels more relaxed rather than forcing a set schedule. Break the task into smaller steps, such as starting with hand washing or the face, then moving on gradually to the body. Offer choices to give Peter a sense of control, such as letting him choose his soap, towel, or what to wear. If bathing is very stressful, consider alternatives like a sponge bath or no rinse wipes. Also, respect cultural and personal preferences about privacy, modesty, and who provides care. Lastly, be flexible. Sometimes stepping away and trying again later makes a big difference. Scenario 2. Maria is forgetting the names of people she sees often and is struggling to follow simple instructions at work. What stage is Maria in? Feel free to use the handout to help you answer this. And what are some ways we can help Maria? So, Maria is in the early stage of Alzheimer's. Independence may still be fairly high at this stage. Here are some helpful approaches. Check safety first. Ask yourself if she could get her doing a task alone. If not, let her try it on her own first. Next, reduce stressful situations. If a task feels overwhelming, look for ways to simplify it. For example, we can limit distractions like noise and clutter, provide extra time to complete tasks, use clear and calm communication, allow choices without overloading, providing reassurance and validation. Next, assume ability before helping. Start with the belief that Maria can do the task and step in only when needed. Talk it through together. The best way to know how to help is to ask. Encourage open conversations about what kind of support Maria finds helpful. Scenario 3. Sasha is having trouble swallowing food, often sits quietly without responding, and needs help with dressing and using the bathroom. What stage is Sasha in? Sasha is in a late stage of Alzheimer's. Care at this stage focuses on comfort, safety, and connection. For swallowing, we can offer finger foods or cut food into smaller pieces, provide small snacks throughout the day, and allow plenty of time for eating. And if coughing or choking is frequent, be sure to contact a healthcare provider for a swallowing evaluation. Even when Sasha is no longer speaking or responding, she may still experience the world through her senses. Research shows that we can continue to connect through touch, sound, sight, taste, and smell. Examples include playing her favorite music, reading stories or books that are meaningful to her, applying lotion with a familiar scent or even a favorite scent, brushing her hair gently, or even sitting outside together on a nice day or walking in a familiar place. For help with dressing and bathroom, consider making the environment safer with grab bars or a raised toilet seat, giving clear verbal cues, gentle physical guidance, and extra time. Consider whether seeking outside professional caregiving support may be needed to help you and your family. In this workshop, we covered common complications of Alzheimer's disease, including eating difficulties, incontinence, seizures, and fall risk. We also covered some practical strategies to support safety, comfort, and dignity at each stage, as well as how to connect with a person even in the late stage through sensory experiences and familiar routines, and that sudden changes require prompt medical attention. These are not caused by Alzheimer's. Thank you for watching.